2021, incident of breast cancer has been recorded among women in Malaysia. According to National Cancer Registry, in 2018, 5,482 cases has been reported in Malaysia. A breast cancer remains silent killer among women, and early detection may save life from breast cancer, the silent killer.
Pertama kali itu nampak kecil saya tak tahu lah. Lepas tu saya tanya sama majikan saya pembantu rumah itu India ya. Selepas saya tahu saya apa itu ada penyakit itu breast cancer, saya pun biasalah, biasa kerja pun okey, tak ada masalah. Tapi lepas apa itu rawatan, macam itu dah kan ada tu rawatan itu kemoterapi macam itu, itu dah lah kemoterapi itu lah. Buat kita orang buat kerja tak ada sosial makan tak ada macam muntah-muntah lawyer macam tu lah. Tapi lepas tu habis kemoterapi ambil masa lah sampai berapa bulan macam tu, 3 bulan macam tu lah. Lepas tu okey. Keluarga saya, terutama orang tua saya, terkejut lah. Terkejut saya dapat itu breast cancer itu. Kenapa tiba-tiba dapat penyakit breast cancer? Saya pun tak tahu lah, saya cakap macam tu. Orang tua saya pun risau macam itulah. Lepas tu saya pun tak payah risau lah. Saya pun majikan dan bawa pergi hospital. Pasal keluarga saya tak ada yang ada penyakit breast cancer. Itulah. Saya pun tak, saya pun terkejut. Kenapa lah tiba-tiba saya dapat penyakit breast cancer? Itulah. Okey. Yang apa itu orang yang dapat penyakit kanser, mana-mana penyakit kanser lah, jangan keluar, jangan stres lah. Macam tu, tak payah ingat, tak payah ingat saya dapat breast cancer lah, apakah penyakit kanser lah, apakah, tak payah takut, tak payah. Tuhan Allah ada, Tuhan boleh tolong kita. Yang penting percaya sama Tuhan, itu saja. Itu ketentuan Tuhan, azal maut semua itu Tuhan yang tentukan. Yang penting jangan stres, just be normal macam itulah. Tak payah nak ingat-ingat saya daripada itu penyakit kanser kah, nanti meninggal kah, apa kah, macam tak payah. Just relax saja, tak payah ingat-ingat, tak payah ingat apa-apa macam itulah. Itu saja. Buat itu semua yang mendapat penyakit kanser lah.
A breast cancer developed due to DNA damage and genetic mutation that can be influenced by exposure to estrogens. However, it can be inheritance of DNA defect or pro-cancer genes like BRCA1 and BRCA2. and make it possible to inheritance.
Hello everyone, I'm Dr. Rohinishri from Klinik Kesihatan Pelabuhan Klang. Today I'll be talking about breast cancer. So breast cancer is the most commonly diagnosed cancer in women. It's about 30% of all newly diagnosed cancers. So what are the risk factors of getting breast cancer? So the risk factors of getting breast cancer is if you are more than 40 years old of age, okay, if you have any family history of breast cancer, any use of hormone replacement therapies before, and also your lifestyle. If you're someone who have a BMI more than 25 and if you consume alcohol regularly, you have risk factors of getting breast cancer. So how do we screen for breast cancer? We encourage all women to do a self-examination of their breasts lah. If you find any lumps, you should go and visit your doctor at the nearest clinic. Okay, at any clinic kesihatan, we can plan for a mammogram. The mammogram will be done in the hospital. So if there are risk factors, we will refer you to a tertiary care hospital. If your age is more than 40, if you have a lump of more than 3 centimeters, and you have any clinical signs of malignancy such as loss of weight, loss of appetite, we will refer you to a tertiary care hospital. So at the hospital, they will do a triple assessment, which includes clinical assessment, a mammogram or an ultrasound, and also they will do a biopsy of the lump to discover whether it's malignant or non-malignant.
Hi, so I'll be talking about the clinical findings of breast cancer. As you know, usually most of the type of breast cancer is actually diagnosed by using biopsy. What is biopsy? Biopsy is actually a small needle which is used to treat the tissue which is collected from the breast part of your body. So as we can see, there are several types of clinical findings, or actually known as signs and symptoms, which you can notice from breast cancer. For instance, there are constant pain in your nipple area, which is this pink part, and also an inverted nipple, which is facing downwards. And then you can notice your color changes, also rashes for around your breast part, and size and shape changes. Also, the most important one is the lump and thickening around your breast area. So this can be noticed by also your MRI scan, or also by using imaging tests like ultrasound. So that is all for your clinical findings. Moving on to the cytology findings. As you can see, this image is actually the cytology finding of breast cancer. As you can see, this is the clinical finding of breast cancer. So this is actually the hyperchromatic adenocarcinoma. Also, to mention about the histological of breast cancer, the most prevalent types of breast cancer is actually known as the C type, which is named as classic invasive lobular carcinoma. And the second most prevalent one is this H type, which is actually the papillary carcinoma. All these cells above shows a positive receptor of estrogen in the cancer cells, which can be found in the histological types.
I will explain about the treatment and prevention of breast cancer. The treatment for breast cancer are: first, surgery, which have two types, lumpectomy and mastectomy. Second, chemotherapy. Third, hormonal therapy. Fourth, biological therapy. And lastly, radiation therapy. Breast cancer is highly treatable when detected early. Every treatment has risks, benefits, and there are side effects.
There are several types of prevention from breast cancer: lifestyle changes and exercise, maintain healthy weight and avoid weight gain, eat less meat and nutritious food, limit alcohol usage, quit smoking, try to breastfeeding for women, take medication hormone blocking drugs, and avoid hormone therapy for menopause.
Breast cancer is the most common type of tumor in women in most parts of the world. Although stabilized in Western countries, it is incidence in increasing in other continents. Prevention of breast cancer is difficult because the causes are not well known. So if you have found yourself with any part of tumor or any lump in breast area, do consult your local doctor for further treatment. As we know, breaking the silence is better. Thank you.